There are few remedies which I am going to speak following a fall, or if you have if you have sustained a fracture, or if you have fallen down at home or on the road or office. You don't get panic. There is a possibility that someone would have had a fracture. Then what initially we have to do, because we do not know what kind of injury it is going to be, whether it is really a fracture or not. If it is painful, then ideal would be to immobilize that particular joint or particular limb by just tying with some cardboard or some wooden scale or wooden ruler or something, whatever you have it. Probably you can use it to immobilize it. And most importantly, don't give anything by mouth, even a water or even a food, and don't give anything the person who has fallen down, because we do not know what type of injury it is going to be. If it is a fracture or no fracture, or if it's a simple fracture which can be just treated by applying a plaster in the hospital, or it'll require a surgery. If you give anything by mouth, saying water or any food, then it may delay any procedure or any surgery, if at all it has to be planned. So my advice would be, don't get panic, do this what I'm going to demonstrate, and shift the person to a nearby hospital where they can get a definitive treatment. I am going to use these type of small cardboards just to demonstrate, so that you will know what actually we are looking for and how we can do it. If you have a fracture in forearm or somewhere, there's a severe pain or something, what you can do is just have this and tie this. If you don't have this roller, no issues. Take some cloth, any cloth, and what you have to keep it important is, don't apply tightly, just be firm. If you apply tight, there's a possibility that it may worsen the situation and increase the problem. So just immobilize like this, so that it will not make the fracture move, and it will remain there only, so that the pain will be under control, swelling will be under control. Same way, if you have a injury in your leg where you think there is a problem, just use something like this cardboard and use this and apply it. As I said, if you don't have this cloth, also not a problem. Take something which is available at home or office and just tie it. The idea is just to immobilize the injury part, so that there will not be any movement, and that will give a nice hold, and this will also decrease the pain and also have a control on an injury. If you have ice packs nearby or some ice rolls, just apply immediately whenever there's an immediate acute injury. I have told even in my before videos also, whenever there's an injury, just apply some ice packs. That will decrease the pain. And we do not know what we are dealing with. If there is a severe pain and a person is not able to move his hand or leg, then just apply this firmly and shift him to a nearby hospital, so that they can probably see a doctor, orthopedician. Probably he'll examine you, and he'll take an x-ray and see whether this can be treated with a plaster, or even the plaster is not required. It is just a simple injury. By medication itself will solve the problem. Or if it is some fracture which can be treated only by plaster, or if there are some injuries where they may require a surgery, so that will help. Thank you.